Hello, I'm Dr. Gerald Chodak, and this is prostatevideos.com. In this video, I want to talk about the signs and symptoms associated with prostate enlargement. Many men, as they get older, may be having urinary difficulties. Sometimes they're bothered by it, sometimes they're not. Sometimes you need to have treatment, and sometimes you do not need treatment. So let's first talk about the signs and symptoms. The most common ones are urinary frequency, getting up in the nighttime to urinate, having a slowing of the stream, difficulty starting and stopping the stream, having dribbling at the end of the stream. These are very common as men get older. Do you need to be treated for it? Well, that depends. It depends on whether or not your body is being adversely affected. And then what could that mean? Well, some men may get urinary infections as a result of this problem. Some men may have damage to the bladder, meaning they don't empty the bladder completely. So there's always urine in their bladder, and that contributes to their problem. If left untreated, it could cause permanent damage to your bladder. And then there's also problems with urinary obstruction secondary to a kidney blockage. The urine backs up. This leads to kidney damage. And if not treated adequately or in time, it could lead to permanent kidney damage. So if you have these symptoms, how do you know if you need to be treated? Well, you can see a doctor who can do a physical exam, check the size of the prostate, examine you to see if you feel like you're emptying your bladder, and maybe in some cases do an ultrasound of the bladder to measure how well you empty your bladder. And also a doctor will give you a little symptom score questionnaire. It's called the IPSS score. It asks you a series of 7 questions. And that number determines in part how bothered you are by it. So low scores on that test, scores under 10 or 8, probably don't need any therapy. But if you have a score over 25, well, you're probably going to be needing something because you may have serious problems develop. The other issues that occur has to do with, well, do you need to be treated at all? And that's partly based on your own subjective symptoms. In other words, if you don't mind getting up once a night to urinate or twice a night, if you don't mind losing some sleep, if you don't mind having some slowing of the stream or urinary frequency, then you do not necessarily need treatment. On the other hand, treatment is available to you if you want it, and you and your doctor will decide whether to embark on therapy. Now, certainly we have medical treatment to offer you first before surgical treatment, and those are discussed in the ensuing videos. But at the end of the day, this mainly becomes about subjective feelings. If you're bothered, you get treated. If you're not bothered, you don't get treated unless you're seriously being affected. Certainly, getting up once a night is not a reason for a doctor to convince you to have some type of surgical procedure. If you're not having any evidence of kidney damage or urinary infections or your bladder is emptying adequately, then you don't necessarily need to be treated. So hopefully the other videos will provide you useful information about your treatment options, and now knowing you may or may not need treatment should help you decide what is your next step. Thank you for watching.